Does that mean that it's mental health like further on?
As in, not just the basic stress, it's more anxiety and stress, that kind of thing.
I don't really know. I don't really understand complex mental health. Your everyday person doesn't really know what it is. You just think of someone sort of having
a nervous breakdown or can't cope, anxiety, depression.
Well, they've got some bits right, certainly in terms of complex mental health being more than just anxiety and depression.
Yeah, and I suppose it's people don't really talk about complex mental health in the community, and it's sort of kept away from people, isn't it? So it's good to know that people were respectful in their answers and thinking about it.
There's a lot of work that's been done on sort of more common mental health problems like anxiety, depression, and the sort of things that people come into day to day. But there's still not a lot known about when you're getting into complex mental health conditions, like if you've got schizophrenia and autism, or you've got lots of different problems all playing at once, which then becomes a problem. There's been a lot of work done on the other mental disorders, but the more complex end still feels like there's got a lot of stigma with it.
It'd be better for our patients to have that spoken about more openly.
Yeah, and it normalises it, because it is pretty normal.
Yeah. So how would you describe complex mental health?
Really, it's a serious mental illness like schizophrenia or bipolar or psychotic depression with added complexity. So it might be someone's also got a personality disorder, or they're also autistic, or they've got a learning disability. It's where you get multiple problems which combine together and become more of a challenge for the person than just the diagnosis alone.
Yes, yeah.
I think that works as a description.
I think schizophrenia could be a complex mental health condition.
Schizophrenia or bipolar, you don't know what sort of mood they're going to be in.
so unpredictable, perhaps can be violent or, sort of do things that they wouldn't do when they're on medication.
I honestly don't know much about bipolar or other disorders.
I don't know anything about psychosis at all. No.
Well, they got schizophrenia twice. That was good. And that certainly can be a complex mental health condition. You mentioned psychosis as well, which is pretty much linked to it. The violence bit, people with mental health problems are far more likely to be the victims of violence than they are to be the perpetrators of violence. It's really rare to be violent if you've got a mental health problem.
It's worrying, isn't it, that violence came up and unpredictability and a sort of fear of what would happen.
Not knowing what their mood will be. Whereas actually for bipolar, people with bipolar's mood is normal for most of their life. It's just when they're unwell that it changes.
Well, this is why it's so important to have these conversations and demystify these things. From my experience, people with complex mental health problems don't normally pose a risk to other people and are not violent. And I think if that has happened, it's usually because they're feeling really scared and intimidated. I think it's really important that people understand more about that, because I can understand it's a worry for some, but it really doesn't need to be.
I think the people with complex mental health are feared.
Yeah, I do believe that people, the general public, are fearful of people with complex mental health needs, yeah.
If you hear the word, oh, he's a schizophrenic,
Then the first reaction is to step back and say, well, hang on a minute, I don't know what that person's going to do next.
That was really worrying to hear, that people are worried about people in violence.
It was hard to watch.
I think people are afraid of the unknown, isn't it? And I think the media portrayal of mental health doesn't help that. I think often it's portrayed in such a negative light. Yeah, so it was really worrying to hear that people are so fearful.
Particularly when they don't have to be, because loads of people with complex mental health conditions just live perfectly normal lives.
Yeah.
You can't tell most people with complex mental health problems apart from people who don't, because everybody looks the same.
Exactly.
This is the stigma that's still with complex mental health conditions.
Yes, I agree. I think more education would stop people feeling this way.
Do you think it's something about people being scared of the unknown and what they don't understand.
Yeah, absolutely.
I'm not really sure. I mean, I suppose you go to the doctors and they start you off on some sort of antidepressant.
I do think of straight jackets and padded cells.
Restraint.
Medication.
I think it's really telling that people really don't understand what happens in a complex mental health care setting. It's quite painful to hear because it just shows that people don't know what happens in a complex mental health care hospital in that setting.
I think it's also the fear, isn't it? A lot of that was about somehow controlling dangerous people.
Yeah.
I mean, I don't think I've ever seen a straitjacket. Have you?
No, never. Never.
I mean, the actual treatment for complex mental health conditions is medication, therapy, occupational therapy, cognitive behavioural therapy. There's loads of treatments.
Yes,
and it works as well.
Again, I think people are using what they've seen and maybe old movies that are quite emotive and have stuck in people's minds, and the treatment has come a long way.
Yeah, there is treatment and it works.
Absolutely. So watching these opinions and these videos has really made me think that we need to do more to address the stigma around complex mental health. I think we need to openly discuss what we do, what people with complex mental health go through, and what their experiences are really like. And I think, and I would hope that would work so our patients and people with complex mental health are demystified, and also addresses the stigma for people that work in complex mental health.
Although we've come quite a long way as a society in being more open and understanding other mental health conditions, the really severe end of mental health problems and the complex end of mental health problems still have a huge amount of stigma attached to them. And I think it would be really good if we could get to the point where people with complex mental health conditions get the same sort of level of understanding and support from other people as people with depression, anxiety disorders. Feels like there's still quite a lot of work to do. I think we just need to keep doing it.
Yes, I agree.